All right, so hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. While we meet today on a virtual platform, we can take a moment to acknowledge the importance of these lands, which we all call home. So my name is Autumn Sipis. I am a project manager for the Canadian Coalition for Green Healthcare, and on behalf of the Coalition, Peach Health Ontario, and the Canadian Association of Pharmacy for the Environment, I'd like to welcome you to today's Cut the Carbon Beyond the OR session, Greener OTCs in Practice, launching the Canadian Green OTC Quick Guide. So throughout the event, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of the event today. We will also be recording this presentation, and the recording will be sent to all registrants and will be available on our YouTube channel. So today I would like to start by welcoming Dr. Tarek Hussain to set the stage and introduce today's presenter. Dr. Hussain is a clinical pharmacist, educator, and sustainability leader based in Ontario. He is the co-founder of Weller Pharmacy in Kingston and an adjunct professor at the University of Ottawa, where he contributes to training the next generation of health professionals. Through his leadership with CAPhE, the Canadian Association of Pharmacy for the Environment, Tarek focuses on translating sustainability into practical, clinically sound decisions that can be integrated into everyday pharmacy and clinical practice. Take it away, Tarek.
Thank you so much, Autumn, and good afternoon, everybody. It's an honor and pleasure to be here, and I'm going to set the stage for the introduction that my colleague Aisha will share with you about the guide. I just want to say a couple of points. Tips or remarks before we start the presentation, that this idea of creating this guide is basically the brainchild of Dr. Miles Sergeant. He's here today with us. He's the executive director of the coalition and a renowned physician and an enthusiast in environmental sustainability. We always look up to him in this, and it made so much sense when Miles said, "Why don't we create this?" Because as you all know, that we supplements, vitamins, some minerals, trace elements are used in day-to-day practice, and with our very busy practices as clinicians, sometimes we miss a little bit some of the tips to counsel our patients about it. The other thing that I would like to add about this guide, it is pretty much the first guide of its kind to try to add a sustainability measure to the medications or the molecules that we are presenting in this guide. It's work in progress. This is a very rough draft that you will hear today, and we really welcome your comments, ideas, thoughts, feedback in the chat and even after that. Before introducing my presenter today, I would like also to give you an idea about a very unique collaboration between the Canadian Association of Pharmacy for the Environment and University of Toronto rotation program, where for a year right now, we have created a very unique rotation for the PharmD students at University of Toronto with the Canadian Association of Pharmacy for the Environment. So it's a rotation where the students start to experience environmental sustainability. They are assigned a project or a research, and they start working on it. And basically, Aisha, who is still a student at the University of Toronto in her PharmD program, was one of my students that was assigned the creation of this guide, and she have done an amazing job. And we again appreciate all the support from the coalition to sponsor and host this work for us. So I'm going to now leave the floor for Aisha to present you the guide with all the information, and then we'll come back after that for a question and answer session. Aisha, take it away.
All right, thank you, Tarek. I'm just going to quickly share my screen. So, hello everyone. As Tarek mentioned, my name is Aisha, and I'm a fourth-year pharmacy student at the University of Toronto. I had the opportunity to work on this project as part of one of my fall rotations with Tarek at CAPhE, and Just a little background about me. So, working with CAPhE was particularly meaningful to me because sustainability is rarely integrated into our clinical practice teachings beyond the standard message of, bring all your medications back to the pharmacy. So, this experience gave me a new lens of how to look at our pharmacy practice, especially when it comes to over the counter medications. And with that in mind, this is the Canadian OTC Quick Guide. So the agenda for this presentation is I'll start by outlining the problem that we're facing and why this work is important, including why OTC decisions need a sustainability lens. Then I'll walk through some of the core components of the guide, such as how the information is organized and how it's structured to support quick decision making, as well as show some of the sample pages that have been constructed thus far. And finally, I'll close with touching upon some of the next steps for this project. So to get us started, the problem that we're facing is that OTC medication use is constant in primary care, with decisions often having to be made on a time constraint. Clinicians don't have the time to sift through long monographs or dense references in the middle of a consult, and they require resources that are clear, accurate, and accessible. The resources that we do have, such as RX files or CPS, and even the product monographs, even though they are clinically sound, they are often too detailed for a quick OTC question, and they're not necessarily designed for OTC products. They rarely address sustainability practices as well. There is also no standard framework for what a greener over-the-counter medication choice looks like. Clinicians are often left to interpret what sustainability will look like in their practice, meaning that it's often inconsistent between practice to practice, if it's even considered at all. And even when we do have access to the information that we're looking for, it's often scattered among multiple resources. So it's not practical to pull that information together in real time. And lastly, even though we have multiple products that may offer the same therapeutic benefit, things such as their packaging, their carbon footprint, their disposal impact can be completely different. But that isn't easily visible and easy to compare at the point of care. So with all these challenges in mind, this led to the development of the Canadian OTC Green Quick Guide. The solution was to create a practical, accurate, and sustainability integrated OTC resource that clinicians can easily use in their daily workflow. The intention is not to replace our other references, but to provide a quick, reliable answer to common questions that arise in practice, including those aspects of over-the-counter use that clinicians may not be familiar with. So into the structure of the guide and what we aim to do, the guide includes one-page summaries that cover the most common OTC medication categories, as well as high-use vitamins, minerals, and supplements. The audience is intended to be clinician-focused, so that includes pharmacists, physicians, nurses, as well as learners such as myself who need a quick, accurate reference for OTC information at the point of care. It aims to streamline decision-making by highlighting the key clinical details, such as preferred preparations, dosing guidelines, and important disposal considerations. One of the core features of this guide is the integration of sustainability information. So it brings forward environmental and climate conscious considerations. And this is presented throughout the guide as what we call our eco notes and carbon impact sections. So to show you what some of the pages look like, this is an example of the analgesics page. And like all of the pages that we have in the guide, it starts off with an overview that outlines the most common use of that OTC product group or class, and where applicable, any general recommendations and important clinical considerations. Each page also lists like the approved indications of each medication, as well as practical clinical information such as the dosing, commonly available formulations, and key precautions to consider during patient counseling. And you'll also see what I was talking about before, what we refer to as the eco notes, which highlight the sustainability considerations related to each product or the class of products themselves. And as more data becomes available and we're able to pull that data, we'll be able to expand this section to make it more of the focus of the guide. And then as well, we have a section called the carbon impact. So this is a color-coded section that shows the CO2 emissions data based on a website called UMaker. So UMaker is a healthcare sustainability platform that estimates the categories of carbon footprint for medications as low, moderate, or high. So using the typical stoplight where green is good, yellow is not the best, moderate, and then red is a high carbon emissions. We have incorporated that into the guide to be a quick reference and say, ibuprofen has a higher CO2 emission footprint than acetaminophen. And the last thing I want to point out about this particular page, and it's unique to this page and hopefully expands to more pages that we add, is the behind the counter section. So this is Schedule 2 medications that are available to patients with pharmacist intervention or counseling. And these products represent a more escalated OTC option, and additional therapeutic support is needed, but they are available to our patients. So we also want to have that information there where available. So these are an additional 2 pages that I just wanted to quickly go over. So I also mentioned that we included some vitamin supplements and minerals. So this is calcium, and unique to this page is that it highlights the elemental calcium content, which is often important when trying to determine a dietary supplement, as well as important clinical nuances, such as how calcium carbonate is what's used in hyperphosphatemia for the management in CKD, but the calcium citrate doesn't have that same indication. On the right, I also have a page that shows proton pump inhibitors. So unique to this page is that it also includes monitoring and follow-up considerations, as it's one of the OTC products that patients often take unnecessarily. So providing support for appropriate use and deprescribing where clinically indicated. So as this project continues to move forward, we love to continue to gather feedback from stakeholders, including all of you, clinicians and nurses, on the guide's readability, clarity, and practical usefulness. And this will help us to refine and update the content based on the real world clinical input. And the long-term vision for this guide is to maintain it as a living document with ongoing updates to help expand the scope, as well as including additional eco notes and the carbon impact data, as at this time, a lot of the over-the-counter supplements and vitamins don't necessarily have that information. So expanding that so that we can really have a more cohesive and complete document, as well as the inclusion of more of the behind the counter and Schedule 2 products as applicable. So I would like to thank you all for listening to my quick presentation. And I would also like to thank Tarek and Miles for all the work that has gone into getting this project off the ground and their guidance. And as I mentioned, any feedback that you have would be greatly appreciated. Thank you.
Thank you so much, Aisha, for this quick brief of the guide. And at this point, I'd like to invite Dr. Miles Sargent to join us. Miles, you are here.
Oh, here I
Here you
am.
are. Here you are.
For the record, my involvement is being highly exaggerated to this point, but thank you both.
Well, we just want to hear from you first before we kind of maybe have a little bit of a discussion, the three of us, about this. So tell us, where did you get the like? Because you emailed me one day, say there would be a great idea if we can have such a product or such a guide. So can you kind of elaborate more on this before we open the floor for question and answers?
Yeah, and please put your questions. I would say in the chat because that's a lot easier for me. But I suppose there's a Q&A in there somewhere too. Yeah, so as the people who are in this audience, I have a feeling there's probably a bunch of clinicians in the audience. No, there's a lot out there about the importance of deprescribing. But funny, there's not much out there about over-the-counter meds. And in terms of millions or billions of dollars spent per year, yes, there is more spent on prescription meds, and that kind of directly links to the amount of greenhouse gases that we're putting into making those meds. But gosh, there's a lot of, is it 4 billion per year for over the counters? I'm trying to remember the number. I think we spend $4 billion a year in Canada on over the counter meds. Prescription meds, of course, are hard for clinicians to stop sometimes. I mean, I was speaking as a family physician. If someone has seen their cardiologist and been put on a few meds, and maybe they are problematic for other meds that the patient's on, but it's tough as a primary care doctor to say, hey, that med your cardiologist started, I want to stop that one. Over-the-counter meds are not typically recommended by clinicians. I guess in some cases they might be, like Tylenol for fever, et cetera. But gosh, it's the Wild West, isn't it? The people deciding what they're going to take and how much of it they're going to take, and sometimes not knowing if they interact with the meds that are prescribed. And we as prescribers sometimes don't even know what people are taking. The tough thing about over-the-counter meds, when I talk to family doctors about it, may be true with pharmacy as well. That might be something you comment on, both of you. For a family physician, and especially with patients who have polypharmacy or on a lot of meds, and that might be most typically our geriatric populations, they might have like a full bag of meds and a whole bunch of over-the-counters. And I just know that primary care docs have a tough time to schedule out 15 minutes, half an hour to go through every single med. I won't go into it now. I have asked docs, what are your tricks, et cetera. But bottom line is, I think there's an opportunity here to do something about over-the-counters, and thanks for the great job that you both did. One other thing I'll say, when we did the journey of a pill for clonazepam has 2 active pharmaceutical ingredients, and depending on the manufacturer, somewhere between 5 to 9 excipients. And as Tarek knows, we don't even learn about excipients in medical school. The pharmacists learn about excipients, and those are the things we add to meds to make them digestible. And for those who've seen that article, we found that a possible route is 63,000 kilometers. We found it after we published that a more common route would be 53,000 kilometers, but nonetheless, a journey around the Earth is 40,000 kilometers. It's a long way. Tarek, when we were doing that study, I thought to myself, imagine what the journey of a multivite is. And I'll just leave it there.
Yeah, thank you so much, Miles. These are really very insightful tips and thoughts. And for you who haven't had the chance to read The Journey of a Pill, which is a very interesting and a unique article that was led by Dr. Miles Sargent, I'm just putting it here in the chat. I'm not sure this is going to everybody, so maybe if you can share it, Autumn, with everybody. So we're starting to get some good questions. The first one is from our dear Dr. Karen Cameron. Thank you, Karen, for being here. Is it possible to differentiate between specific brands in the selection of a group or product, e.g. acetaminophen brands, for example? I'm going to comment on your thoughts, Miles, but just so to start taking some of the questions. So, what do you think, Aisha? Do you think we can do brands maybe at part? And I think one thing else that I want to maybe put out here is the interactions, because Miles said about it, and I don't think we have interactions, or should we
Mhm.
include it, and how deep can we go with this, because it's a whole big um, uh, space. So
Yeah, so in regards to the difference between the different brands of, say, the same medication, it's very hard to try and capture all of them because, of course, you have like your big brands like your Life brand, your Jameson, things like that, that it's relatively easier to pull the information from. But it can get very convoluted. So I did find, like, say, even looking at magnesium supplements, there's so many different magnesium supplements, and the way that they're constructed, it might have multiple magnesium salts mixed together. So to try and put that in a one-page summary, it wasn't quite possible. But where there's recommendations of like the elemental content of things, I was picking the more common. So like the calcium carbonate, everyone knows about Tums. So that's kind of the first go-to. But then I would imagine that if anything beyond that really wants to be used, that's where like the pharmacist aspect comes in of like making a recommendation.
okay, thank you, Aisha. I think to add to this, and I see Karen did add something, would a local generic brand would be more eco-friendly? I actually would be surprised, Karen. I think it's most of the we call them the no-name brands, like the one that is manufactured for different corporates. Options Plus is one of the things that several banners use. Pretty much are manufactured in the same facility where the brand Tylenol, for example, in this case, would be manufactured. So I would be very surprised. And the other question about that would be where we can get this data. Like, do we have environmental footprint for the brand Tylenol, for example, versus the no-name brands, if they are not manufactured in the same facility? So these are still some good questions, Karen, that we can definitely dig deeper into. And it might take us I would say, a few years to be able to add it to the guide in version 10. I hope so. So that's that's one thing. We have a couple of more questions. Go quick.
Sorry,
Go.
I'm sorry,
Sorry.
Tarek.
Go ahead,
Yeah,
Miles.
I do have something to add here. One thing our Peach group that does the research, I think we make a mistake of, is we make our titles of our articles too long, and then I can never remember the title of an article. But a few years ago, we wrote an article about uh, about the supply chain in general, and as people may know, the production of meds is 22%, at least in the English study, and then MDI inhalers and anesthetic gases on top of that are another 6% in their direct emissions. So 22% of the whole thing is pretty massive. And then supply chain in general, including other things that we buy, is somewhere between 60 to 80%. So, we have thought a lot about, what can we do about that? And one thing we can do, and I'm not just talking about healthcare here, I'm talking about our own personal decisions, is there are groups out there that have been rating companies for years. And CDP.net comes to mind. That was the Carbon Disclosure Project, short CDP.net. And you can go to their website and you can look sector by sector. You're buying clothes, or you're looking at meds or whatever. You look sector by sector at how they rate companies. And I believe, I haven't looked at that in a while, they rate them based on carbon footprint, forest footprint, and water footprint, essentially. So in terms of meds, I'm not so sure about the big over-the-counter companies, but I do know that if you're looking at the AstraZeneca and Roche and Merck, et cetera, you can find how those companies rate. So that is a direct answer to Karen. If you want to go to that trouble, you can see which companies are taking this more seriously. And if I can remember the name of the article, we listed all the places that you can go for this kind of stuff. I'd say even better than CDP is an offshoot called SBTI, which is Science Based Target Initiative, SBTI, which rates companies as well. Something out of Canada called Corporate Knights. That's Knights with a K. They rate the top 100 companies every year. And finally, just in terms of personal buying, you can support B Corps. So if you're not familiar with that, look up B Corps and consider where you're buying your clothes, etc. from. That's, yeah.
These are all very good points, Miles. I would love if we can share those on the chat. At least if Autumn can help us and share the links to the organizations you mentioned we still have half an hour, so we can do that. But also to complement with you and Karen's comments, Dan actually have a very interesting point. He say often a driver for carbon footprint is the source country for the API, with India and China cited as carbon intensive. Have you looked at that, or just UMaker only so far? So yeah, just UMaker so far, but definitely it might make an interest. And this actually make me think about maybe creating a score that combines UMaker as percentage of the score, and then maybe other um, like other parameters, like including where the source country is, maybe the websites that you or the organization you mentioned, Miles, about giving the score to the pharmaceutical company who's producing the supplement, or maybe it's an idea. I think we might need to maybe further look into it and see how feasible it is, so it can be fair. I think that's interesting.
Sorry, I'm just going
Caroline,
to jump in,
sure.
and I think Aisha, I think Aisha's. Are you finished the project? You still working on it? I mean, I know you finished your work.
Well, as more things come up, then yeah, make those adjustments because
So
yeah,
what
it's
I
gonna
would suggest
feel
about the idea of comparing brand names and different companies is maybe we just simply go to one of those sites I'm talking about. I'm just going to say SBTI, and we find where pharma is listed, and we put that as a link, and then people can go and kind of explore that.
Sure, it can go in the first page, because we're trying to give some general notes at the beginning before going into the tables, and that might be a good like including UMaker website and a couple of
Yeah.
other websites.
And
Yeah.
and you just made me think of one other thing. One other collaboration we have with CAPhE right now is that UMaker is based out of the NHS England, and we are so it's, of course, it's all paracetamol, is that what they call it, Tarek?
Yeah,
Acetaminophen, yeah.
yeah.
So it's all the English meds, English doses, but we are bringing that over to Canada, and we're pretty much finished. And so we'll be putting that on our website. So the list of, I think we've got maybe the top 1,000 prescribed meds in Canada that we'll be putting on there.
Yeah, that is an exciting project with my colleague Loretta as well, working on it. So yeah, very, very well done. So Caroline have a very interesting question as well. Say hi, team. Thank you so much for this initiative and the fantastic resource. Thank you very much, Caroline, for the support. I'm wondering if you plan to include in additional non-carbon impacts. In kidney care, we are doing an analysis of our entire renal formulary and have located publicly available European sources about toxicity, bioaccumulation. This is in aquatic life. Yeah, definitely. This is a very interesting question, Caroline, and I think it's we had some very few non-carbon impacts. Like for example, Aisha, you can share a couple of examples
Yeah.
if you want to, and then I'll yeah.
Okay, let me just open this here. Okay, so for example, like magnesium, we did find that there is, like, say, a low environmental persistence. So in that regard, that it doesn't bioaccumulate and it's not much of a concern. But there are other OTCs that did have an issue with bioaccumulation. Or like, so even the calcium carbonate, how it requires mining and quarrying. So that contributes to emissions. Some medications, they were shown to bioaccumulate in zebrafish. So the data is out there a little bit, but it's not there for everything. So where it is available, we have included it in the eco notes and have referenced it at the end, of the document.
Yeah. So we would love to hear more about the sources that you have, Caroline. If you can reach out to us, we'd look into it. The other thing as well is regarding this point is this is an area for improvement for the second or third edition of definitely adding um, some more environmentally related risks. We are very one of the core I would say objectives of this guide is particularly for kidney care because we know that so many medications over the counter like vitamin D, for example, calcium. There is also a confusion among users and some of the clinicians about the elemental dose and the salt dose. Calcium carbonate, for example, how much is producing elemental calcium, the same like iron. So I think these are areas we're trying to highlight in the guide. I think the biggest challenge for me as a pharmacist would be to reflecting on one of your points, Miles, about the family doctors is like the people going to the pharmacy and picking up the the supplement and leaving without a consultation. I think that would be a point. I don't know how can we maybe put signs in the pharmacy and say if you're taking this for the first time and even if it's an over the counter, can you have a quick word with the pharmacist? I'm not also sure how pharmacists will feel about that because they are already so busy, but it's just the feeling that we really need to make sure that they are taking the right dose, the right product for the condition that they are looking for. um the and okay, so the next one, and appreciate Karen have lots of amazing comments, and I really appreciate your excitement, Karen. Thank you so much. But we get the point about there's an information about drug dosage. Yeah, the information are there. We're trying to put the recommended dosage for the particular indication that the drug is used for, and particularly for stuff that are not common, like when you talk about the renal dosing, for example, for vitamin D or for calcium. That's just an example. Laura has a question as well. Any thoughts of bringing in the dose? Yeah, the doses are, I think the doses are there, right? I'm sure that there are doses. Yeah.
Oh,
Yes.
sorry. Yeah, I replied. I thought I was replying to Karen. Hi, Laura. Thanks for asking. I know in our UMaker work, we're going to be showing the difference between doses. The UMaker work, we don't have every over-the-counter med. We'll try to add some more, mainly the prescribed meds. Go ahead, Aisha.
Yeah, I was going to say that there is some difference in the carbon footprint between, say, like 30 milligrams of codeine versus 60. But yeah, because the data isn't quite there for the over the counters, it's really hard to try and break it down in that way. But yeah, just reasonably thinking about if I have to take two tablets of a 10 milligram versus one tablet of a 20, you would assume that probably the one tablet of the 20 has less of an environmental impact just because less bottles, less pills, less waste in that sense. But it doesn't always ring true. So yeah, we still have to look deeper into that and try and find that data.
Yeah. And one more point, having this guide out, I think that can be a good support for asking for more of these data from the companies who are already creating like UMaker or other organizations. Like we have been developing this, we're finding these questions we cannot answer. Can you help us finding some answers if they have some tools to do that? So I think that would definitely help with this. Rose is asking, do generic brands go through a different manufacturing process, i.e. less steps than brand names options? We can use acetaminophen. So for example, even if they are manufactured in the same facility, I don't think so. Manufacturing is manufacturing, Rose. My understanding is I'm not an industrial pharmacist, but my basic understanding is that the process of manufacturing is pretty much standard. I think what makes a brand different from the generic is the research based and coming up with new formulations, for example, like faster relief or sustained. So the different formulation that goes there. And one interesting example is one of the ADHD medication. I'm sure it's Concerta, that the layers, the way that they have the release layers on their tablet or their oral form, um, no generic company was able to get the same outcome like the brand. So that shows the value of research. But when you come to manufacture that, unless there is a really different um, dosage form that requires extra steps in creating those layers or creating this special um, capsule or special dosage form, I think it's pretty standard process of manufacturing. So that's my kind of basic answer to this. Rob, how are you, Rob? Rob Pummett from CAPhE is the Director of Education. Ivy as well is here, so thank you, Ivy, for being here. Um, so Rob saying, is there information on the difference between the maker levels used? For example, an amber level medication have a 2x higher carbon footprint than the green. That's a very good question. I honestly don't know, but
Yeah, I did answer that in the chat. It's each level is 10 times.
okay,
So you go from 0.1 to 1 to 10, etc.
okay.
I guess the thing we don't know is if a med was, let's say, 0.9 and another med was 1.2, they would end up in different colors and not actually be separated that much, right?
Yeah. And Caroline shared some of the resources. Thank you so much for sharing that with us. Tibu, how are you? Good to see you here. Looking forward to your February 25 webinar. This is very exciting about plastics, another area we are very interested in, and hopefully work together on this. Thank you so much. I assume that drug monographs are tightly regulated and somewhat harmonized across Health Canada, FDA, and EMEA. Are you aware? Okay. Are you aware of any regulatory initiatives to require the monographs include sustainability metrics? Very good question, Thibaut. I am not aware of any, at least for in Canadian jurisdiction. Aisha, do you have different information or something?
Second.
Okay.
Can I put Ivy Lamb on the spot? It's always
Yeah.
fun putting Ivy on the spot.
Yeah.
I want Ivy, do you have any knowledge about that? She might be eating her lunch, who knows? Ivy, if you know anything about that, go ahead to put it in the chat, or you can jump on in a minute.
Yeah, I'm pretty much sure that this is going to be a very difficult area because when you talk about the regulatory kind of environment, it takes some time to be able to kind of mandate that, and it might be something that they might allow companies to put as kind of voluntarily, not by kind of regulating it or forcing them to put it or require it. That's my understanding. But let's see what
Yeah,
Ivy and Aisha, go ahead. Yeah.
so like from what I've seen, there isn't really a standardized way of like incorporating all the information. Mostly it's just about the disposal, but they don't really dig deeper than that. And even then, most of it is just returned to the pharmacy. Some companies and some drug monographs will add a little bit more if there's like special precautions. But it's very hard to, yeah, find that data and find that information.
I see Dan's question, Tarek, and I think it's a direct challenge to you. I think that he is challenging you to be the first pharmacy. Have you seen that one?
I see that the designated pharmacy where, thank you, Dan. That's a very nice future. I'd love to be there already, but we need to pave the way for that. I think all of us and you guys here being with us, I think it shows your interest in this. Imagine a future in which a patient can walk into green designated pharmacy where the products have been curated by environmental impact. Shelf labels with green, yellow, and yeah. manufacturing. I'm definitely with you on this. Then, yeah, the packaging has to show the environmental impact, and to add to all the excellent comments we had, like it can show not only this, but it can show the impact on in the environment we live in, like the sea, the animals, the different things, because that's a whole different dimension of the problem. We're seeing it from the end where the product is on the shelf and somebody's picking it up, and we're trying to mitigate it at that level, or at least reduce the impact. But it's a whole chain, and yeah, definitely I would love to see that future. And Caroline, have another question.
So I'm just going to jump in and say something which is probably obvious, but I think it always needs to be pointed out. No different than making the MDI to DPI switch. That always starts with the diagnosis. Are we treating reflux disease as asthma and giving someone in it? So it always starts with diagnosis. Then it starts with switching to, long-acting meds. You don't have to use as many, relief meds. And then we get into the switching from DPI to MDI, MDI to DPI if it's safe, et cetera. And so same thing here. I mean, this obviously starts with the fact that, can we educate our patients? People spending a ton of money, $4 billion, nationwide. This is just me guessing. I bet the majority of those meds aren't really useful or needed. So yeah, can we start there? And is there some sort of substitute? They don't even require the med. And then talking about the U-maker type stuff, and obviously making sure that it's safe, number one. So yeah, look, I love the idea of the green pharmacy and the aisles and stuff, but it would still obviously need to be patient safety. Yeah.
It's a whole yeah. And I would say something that I hope that Dr. Lisa McCarthy is here, but I don't see her in the audience, but she will be very happy to hear the appropriate use, to Miles' comment. So is this indicated as per, so diagnosing as a physician, when comes down to us as a pharmacist, is it indicated in this, or can we really deprescribe it if it is not needed? And if it is needed, is it used appropriately, and how can we educate about it? And if there is a chance to switch to a greener alternative like the MDI to DPI example, then that's probably will be excellent. Caroline, your question is pretty much matching with the previous things about initiatives to mandate pharmaceutical generics companies public emission data. I don't see any mandate from governments to force them to declare, any pharmaceutical company to declare. I think Ivy as well just shared that she doesn't have any knowledge of any regulatory approach to do that. But saying that, most of the companies, I would say at least the research-based pharmaceutical companies, they have a sustainability page in their website, and they normally, in some of their annual reports, they normally declare some of the numbers. But I think it's still voluntarily, it's not mandated. And maybe by time we will start to get to more stricter mandates, even though I'm seeing the whole world going a little bit the other way around when it comes to the targets. For example, we have been seeing this year so many countries have decided that they were not going to reach the targets for emissions. And correct me if I'm wrong, Miles, I heard yesterday that the agency itself said that it cannot regulate the emissions because it has gone beyond its capacity to regulate it. So I see the world in a very interesting place right now. So I'm not sure if even any regulatory body started to say, let's mandate this, how the impact will be on the pharmaceutical industry in general. There is also an interesting talk that I gave in 2024 to the Canadian Pharmacists Association it's called Seeing Through Green. If you want to go there, I talk a lot about the different scopes, scope 1, scope 2, and scope 3 of emissions, and the difficulty of accounting for scope 3. And that is, I think, one of the challenges for pharmaceutical companies and for us, even if we would like to count from our side how bad is or how good is this product to the environment. So there's a lot of things that we need to still work on when it comes to that. Miles,
I did not see that news. Was that just yesterday?
I think it was yesterday the EPA, I guess they said that they are. I read it very quickly. I might have been half asleep, maybe. I'm not sure. Yeah. Um, Aisha, do you want to share something with just highlight something on the guide or?
No, just so people can see the page.
Okay,
Yeah,
yeah, perfect.
the
Yeah, thank you,
pages.
Caroline. Thank you. For these are excellent points and questions. Any further suggestions for the guide? Yeah, I see here more questions to think about it. Rose saying, as a coalition member with a background in medical chemistry, I find this topic particularly exciting. How can we collaborate in developing this guide with a focus on the environmental impact of OTC? Rose, robust recycling, amazing. Thank you so much. I'm happy that you like it. I would love to hear from you more if we can chat offline and see how can you add to this. I mean, hopefully within the coming few weeks, we'll have a public version available through the coalition website. And this will give you the chance to take a look at it and give us some more feedback so we can develop it further. Um, Yes, it's going to be Marie-Pierre. Thank you for the question. I think we're going to have it as a PDF file to start with, hopefully in the coming few weeks, as I mentioned. But definitely, if we have the resources to have it as a kind of a searchable database living on the coalition website, that would be very exciting too. I would love to see that, but it will
Sorry,
depend on.
I have something to add to Caroline's question, first half of her question a
Mhm.
few minutes ago, which is mandating companies. The way I read it is, is anyone mandating companies to be transparent? And so, as I say, there are these groups that are often not for profits that are doing. So, for example, the CDP initiative, Carbon Disclosure Project, I think it started in 2000. You can imagine 2000 when this not for profit reached out to companies and said, hey, what's your carbon footprint? Most of them didn't know, most of them didn't want to participate. And I think they might have started with 100 companies. And last time I looked, now they have over 20,000 companies in the world that do, report. But that, of course, is as as an entire business, how they're doing. In terms of products, it was a few years ago that the NHS England was saying that they were going to start looking or demanding that all the companies they worked with were transparent by 2027. And then I think they backed down, but yeah, I wouldn't mind looking back into that. But at one point, the NHS, maybe 3 years ago, time flies. It seems so far away. I think it was like 2027 or 2028, that they wanted all companies that they were going to work with to be fully transparent, about their products. So I don't know where that's at, but that thought is certainly out there.
Yeah, for Rose and for anybody who wants to further discuss, I'm going to put my email here on the chat. Feel free to reach out and we can talk further about this. Yeah, it's here. Yeah. Yeah, it's gonna be interesting to see that, Caroline and Miles, like that we have. I honestly don't. I think that everybody has a responsibility to kind of be transparent about that. Like it doesn't. I don't want to see it going to the limit that the government has to mandating that you have to show us what you're doing. Like, I think it's good practice, ethical, to kind of at least you come and come forward and say, hey, this is what I'm doing. This is what the good things I'm doing about the environment. This is the limitations or the challenging I'm having. And even when you do that, you'll probably be able to get people to come and try to help you find solutions for you to mitigate those challenges. But yeah, I see that sometimes you might need to mandate it. Let's see how the next few years will look like.
Someone, this is going back a little bit, was asking, I think it's in the chat, about the fact that we focus on greenhouse gas and there's other, obviously, environmental concerns. I suppose greenhouse gas has sort of become a common language and it's something we can measure. I think that's part of the reason it's maybe overly talked about. But if you look at the nine, is it nine? I think it's 9 planetary boundaries. I'm pretty sure it's 9 from Rockstrom back in 2008, and that's obviously been modified. And the fact that are we now past 7 of them? But the point is, if you look at the 9 planetary boundaries and you look at carbon footprint, global warming, all these things, that does overlap with 6, maybe 7 of the planetary boundaries. And I think there's 2 things that we can do which overlap with all 9 planetary boundaries. And one of them is to consume less. So both as individuals and as a healthcare industry, consuming less impacts all 9 planetary boundaries. And the other one that hits all 9, and we see this in the Lancet Eat, is switching to plant-based eating. Might be a little off topic, but just throwing that out.
Yeah, I would add to this, Miles, that we also have the social determinants of health are becoming now, hopefully, people putting some more spotlight. It's one of the areas that I'm very kind of fascinated and enthusiastic about. So identifying social needs that basically are responsible for 50 to 80% of the medical needs that our clients or our citizens see would definitely and addressing them will definitely reduce the burden on healthcare. And when we do that, we reduce the environmental emissions of the whole sector. And that's huge. I think healthcare, if I'm not mistaken, it's the second, Miles, the second largest emitting industry in the world. Let's say it's the second or the third. It depends from different report to the other.
I'm not actually sure about that. I mean, obviously, I think we all hear some of those numbers in terms of nationally 4.6 more than the airline industry, et cetera. We would be the 5th largest nation collectively looking at healthcare. But yeah, I actually don't know where it stands up compared to other industries. I know it's highly intense industry.
Yeah. And most of the stuff coming from the energy needed to kind of power hospitals and power different clinics and pharmacies and all that stuff, as well as supply chain. So these are interesting points to see. We have, I would say, a few minutes. If anybody has final thoughts, questions for us, we will be very grateful to take it back and update our guide.
Well, if there's nothing else, I'd like to say thanks to Aisha and Tarek for doing such a great job on this. And thanks so much for talking today. We like to think this is the first ever over-the-counter talk. Probably isn't, but it's fun to call it that. And thank you to all of you for coming today. And hopefully you've learned something.
And we're going to give you 5 minutes back. So thank you. Yeah. Thank you, everybody.
Thanks, everyone. Take care. Have a great weekend.